Hello everyone, my name is Raleigh, and for my expert project, I chose to do mine on amnesia. The reason I chose to do my project on amnesia was because right around the time we were picking topics, I was learning the memory loss unit in my psychology class. I thought it would be very interesting to do more research to have a better understanding of what amnesia is. What is amnesia? Amnesia refers to partial but serious loss of memory. For example, someone cannot remember their mom's maiden name or what happened last Christmas, but may recall the joke their brother told them a few seconds ago. Unlike in the movies, real life amnesia generally does not mean you lose your sense of identity. In fact, patients know who they are but may have trouble learning new facts and forming new memories. Amnesia is believed to be caused by damage to areas of the brain where memories are processed and stored. While there is no specific treatment, techniques for enhancing memory and psychological support can help patients and their families cope. What are the symptoms of amnesia? The two main features of amnesia are difficulty learning new information following the onset of amnesia, which is commonly referred to as anterograde amnesia, or the difficulty remembering past events and previous familiar information, which is commonly referred to as retrograde amnesia. Most people with amnesia have problems with short term memory. Recent memories are most likely to be lost, while more remote or deeply ingrained memories may be spared. Someone may recall experiences from childhood or know the names of past presidents, but not be able to name the most current president, know what month it is, or remember what was for breakfast. Isolated memory loss doesn't affect a person's intelligence, general knowledge, awareness, attention span, judgment, personality, or identity. People with amnesia usually can understand written and spoken words and can learn skills such as bike riding or piano playing. They also may be able to understand that they have a memory loss disorder. Amnesia isn't the same as dementia. Dementia often includes memory loss, but is also involved in other significant cognitive patterns that lead to a decline in daily functioning. What are the causes of amnesia? Normal memory function involves many parts of the brain. Any disease or injury that affects the brain can interfere with memory. Amnesia can result from damage to brain structures that form the limbic system, which controls your emotions and memories. These structures include the thalamus, which lies deep within the center of your brain, and the hippocampal formations, which are situated within the temporal lobes of your brain. Amnesia caused by brain injury or damage is known as neurological amnesia. Possible causes of this include stroke, brain inflammation, lack of oxygen, long term alcohol abuse, tumors, degenerative brain diseases, seizures, and certain medications. Head injuries that cause a concussion, whether from a car accident or sports, can lead to confusion and problems remembering new information. This is especially common in the early stages of recovery. Mild head injuries typically do not cause lasting amnesia, but more severe head injuries may cause permanent amnesia. Another rare type of amnesia, called dissociative amnesia, stems from emotional shock or trauma, such as being the victim of a violent crime. In this disorder, a person may lose memories, but usually for only briefly. What are the ways to prevent amnesia? Because damage to the brain can be a root cause of amnesia, it is important to take steps to minimize your chance of a brain injury. For example, avoid excessive alcohol use. Always wear a helmet when bicycling and a seatbelt when driving. Treat any infection quickly so that it does not have a chance to spread to the brain. Seek immediate medical treatment if you have any symptoms that suggest a stroke or brain aneurysm, such as a severe headache or one sided numbness. Now on to some famous cases. The case of Henry Gustav Malazan is the most famous case of amnesia to date. In 1953, he underwent an experimental brain surgery in order to cure his severe epilepsy that removed large sections of his temporal lobes, which contain the hippocampus and the amygdala. He emerged from this surgery with severe anterograde amnesia and graded retrograde amnesia. HM had a functional short term memory, and he could remember his name and many memories from before the surgery, but had trouble forming new long term memories. The next patient I would like to talk about is Clive Waring. Clive Waring is a British musologist who developed severe anterograde and retrograde amnesia due to brain damage in 1985. His memory only lasts around 30 seconds before it is completely wiped clean. Similar to HM, research involving wearing showed that explicit, declarative, and implicit, and procedural memory are all separate because he was able to retain his musical abilities despite having no memory of learning music. The next patient I would like to talk about is patient EP. EP developed anterograde and retrograde amnesia after brain damage to the medial temporal lobe when he was 79 years old. Knowing that previous cases of amnesia with damage to this area were already able to learn the new information, researchers still decided to study him. Researchers found that he improved his ability to learn three-word sentences over a period of 12 weeks. When the sentences were changed, he was not able to answer correctly, which led researchers to conclude that he was learning information despite the fact that he could not remember learning it. Now finally, patient KC. Patient Casey suffered damage to his frontal lobe and his hippocampus as a result of a severe motorcycle accident when he was 30 years old. He had no episodic memory, meaning he cannot remember personal events, but he did have semantic memory, meaning he can remember facts, knowledge, and information from the past. Researchers found that Casey could learn and retain semantic knowledge through experiments where he was taught 64 three-word sentences over many trials, and then a year later was tested again and was able to recall 24 of the 64 sentences. Brain imaging studies also provide evidence that episodic and semantic memory actively separate brain areas. Why does this matter? There are over 850,000 people that suffer from some form of amnesia. Given that statistic, even if you are not directly impacted by a memory loss disorder, the odds are you will likely come across a family member or friend that is. Overall, I found this to be a very interesting as well as relevant project. As early intervention has been shown to help reduce symptoms, I also felt like it was important to include techniques that have been shown to be effective. Techniques include hypnosis, energy psychology, neurofeedback, cognitive theory, occupational therapy, and nutrition. Thank you.